Deciding to have an abortion is a significant and personal choice, and it's completely normal to have a lot of questions. Your health and safety are the top priorities, so it's crucial to understand the proper procedures and what makes an abortion safe versus unsafe. This guide is here to provide you with comprehensive, fact-based information. We'll walk you through the entire process, from making the decision to post-procedure care, ensuring you have the knowledge to make informed choices for your body and your future. First and foremost, a safe abortion is one performed by a trained healthcare professional in a clean medical environment. This could be a doctor, a nurse, or another qualified clinician. Unsafe abortions, often performed by individuals without medical training or in unhygienic conditions, pose serious risks to your health, including severe bleeding, infection, and long-term complications. According to the World Health Organization, WHO, nearly half of all abortions worldwide are unsafe, leading to preventable deaths and disabilities. This is why accessing legal and professional medical care is not just important, it's life-saving. The first step in having a safe abortion is confirming your pregnancy and determining how far along you are. You can start with a home pregnancy test, but a healthcare provider will give you a more accurate confirmation, usually through a blood test or an ultrasound. The ultrasound is particularly important as it confirms the gestational age, which is the number of weeks you've been pregnant. This information is critical because it determines which type of abortion procedure is suitable for you. It also checks for an ectopic pregnancy, a rare but serious condition where the embryo implants outside the uterus, which requires immediate medical attention and cannot be terminated with a standard abortion. Once your pregnancy is confirmed and the gestational age is known, you'll need to find a reputable clinic or hospital that provides abortion services. You can start by searching online for abortion clinics near me or family planning centers. Organizations like Planned Parenthood, the National Abortion Federation, NAF, and local health departments often provide lists of trusted providers. Be cautious of crisis pregnancy centers, as they often present themselves as comprehensive health clinics, but are typically anti-abortion organizations that may provide misleading information to dissuade you from having an abortion. A legitimate clinic will offer a full range of reproductive health options and respect your decision. When you contact a clinic, they will schedule a consultation. During this appointment, a healthcare provider will discuss your medical history, explain the available abortion methods, and answer any questions you have. This is your opportunity to get all the information you need. Don't hesitate to ask about the procedures, potential side effects, recovery process, and costs. A good provider will be transparent, supportive, and non-judgmental, ensuring you feel comfortable and confident in your decision. There are two primary methods for safe abortion: the medication abortion, often called the abortion pill, and the in-clinic or surgical abortion. The best option for you will depend on your gestational age, medical history, and personal preference. Let's start with medication abortion. This method is usually an option up to 10 or 11 weeks of pregnancy, depending on local regulations and clinic protocols. It involves taking two different medications to end the pregnancy. The first medication is mifepristone. This pill is typically taken at the clinic. It works by blocking the hormone progesterone, which is necessary for the pregnancy to continue. By blocking progesterone, the uterine lining begins to break down and the pregnancy cannot grow. The second medication is misoprostol. You will usually take these pills at home between 24 to 48 hours after taking mifepristone. Misoprostol causes the uterus to contract and empty, similar to a heavy period or an early miscarriage. You can expect cramping and bleeding to start within a few hours of taking misoprostol. The bleeding will be much heavier than a normal period, and you will likely pass large blood clots. This is a normal and expected part of the process. Most people pass the pregnancy tissue within 4 to 6 hours, but bleeding and cramping can continue on and off for several days or weeks. The clinic will provide you with pain management options, such as ibuprofen, and guidance on how to manage the bleeding with heavy-duty sanitary pads. Scientific research confirms the high effectiveness and safety of medication abortion when administered correctly. A comprehensive review published in the journal Contraception found that medication abortion is successful in over 95% of cases and has a very low rate of serious complications, lower than that of carrying a pregnancy to term. The other main option is an in-clinic or surgical abortion. This procedure is done in a clinic or hospital by a trained doctor. There are a few different types of in-clinic abortions, and the one used depends on how far along the pregnancy is. The most common type is a vacuum aspiration, which can be performed up to about 14 to 16 weeks of pregnancy. During this procedure, the doctor will numb the cervix and then gently widen it. A thin tube is inserted into the uterus, and gentle suction is used to remove the pregnancy tissue. The procedure itself is very quick, usually taking only 5 to 10 minutes. You may experience some cramping during the process, but the clinic will provide pain medication and possibly a local anesthetic to make you more comfortable. Some clinics also offer sedation options, ranging from light twilight sedation to general anesthesia, where you would be asleep for the procedure. For pregnancies further along, typically after 16 weeks, a dilation and evacuation (D&E) procedure is used. This is similar to a vacuum aspiration, but involves more significant dilation of the cervix and the use of medical instruments in addition to suction. A D&E is a more complex procedure and is always performed by a specialized doctor, often in a hospital setting. It may take place over 2 days, with the first day dedicated to preparing and dilating the cervix. Both vacuum aspiration and D&E are extremely safe when performed by trained professionals. The American College of Obstetricians and Gynecologists, ACOG, states that legal abortion is one of the safest medical procedures in the United States, with a major complication rate of less than 1%. After either type of abortion, recovery is a vital part of the process. For a medication abortion, you will likely need to rest for a day or two as the most intense cramping and bleeding subsides. You can usually return to normal activities, like work or school, as soon as you feel ready. After an in-clinic abortion, you'll spend a short time in a recovery room at the clinic for observation. You'll be able to go home the same day, but you will need someone to drive you if you received any form of sedation. Most people feel well enough to resume normal activities within a day or two. Regardless of the method, it's normal to experience some bleeding and cramping for a few weeks after the abortion. Your clinic will give you specific instructions on what to expect and what signs to watch out for. It's crucial to follow all post-procedure instructions. This includes avoiding inserting anything into the vagina like tampons or having sex for a week or two to reduce the risk of infection. Your provider will also schedule a follow-up appointment to ensure the abortion is complete and you are healing properly. Warning signs of a complication include very heavy bleeding, soaking through 2 or more maxi pads in an hour for 2 hours in a row, severe pain not relieved by medication, fever, or foul-smelling vaginal discharge. If you experience any of these symptoms, you must contact your clinic or hospital emergency room immediately. Emotional well-being is just as important as physical health. People experience a wide range of emotions after an abortion. Relief is the most commonly reported feeling, but it's also normal to feel sadness, guilt, or a mix of emotions. There is no right way to feel. A study from the University of California, San Francisco, which followed women for 5 years after having an abortion, found that over 95% of them felt it was the right decision for them, both immediately after and years later. If you find yourself struggling emotionally, don't hesitate to seek support. Talk to a trusted friend, partner, or family member. Many abortion clinics offer post-abortion counseling or can refer you to a therapist who specializes in reproductive health. Support hotlines like All Options also provide a confidential, non-judgmental space to talk through your feelings. Finally, let's address the legal and financial aspects. Abortion laws vary significantly by state and country. Some places have gestational limits, mandatory waiting periods, or parental consent requirements for minors. It's important to be aware of the laws in your area. The Guttmacher Institute and the Center for Reproductive Rights are excellent resources for up-to-date information on abortion legislation. The cost of an abortion can also be a barrier for many. The price varies depending on the type of procedure and where you live. Some health insurance plans cover abortion, but many do not. If you need financial assistance, there are organizations that can help. The National Abortion Federation, NAF hotline, can connect you with financial resources, and the National Network of Abortion Funds is a coalition of local organizations that help people pay for and access abortion care. Never let cost prevent you from seeking a safe, legal abortion. Help is available. Having a safe abortion means prioritizing your health by seeking care from trained medical professionals. It involves understanding your options, asking questions, and following post-procedure care instructions carefully. Remember, your body, your health, and your decision are what matter most. You deserve to be treated with dignity, respect, and compassion throughout this entire process. For more reliable and compassionate information on sexual health, be sure to subscribe to Sex Education Repo.